neuromuscular decompression versus traction. So a lot of chronic pain and a lot of body pain in general, whether it's acute, chronic, or from time to time, occurs at the joints, and a lot of the time, if not most of the time, that is due to compression. That is due to bones being pushed too much together, so they're jammed together, but then on top of it, when they move, there's no space, causing discomfort, irritation, inflammation, arthritis, inflammation, the itis of the joint. And what should be happening is there should be a little bit of space in a healthy joint. There should be a little bit of space so that even just sitting like this, it's comfortable, but especially in movement, there is space to move instead of like so. And this is very commonly experienced in the spine, no more so than in the low back, where muscles are jamming vertebrae towards each other and squishing the disc in between. But it can also happen at the hip joint, where the thigh bone is just jamming up into the hip, the socket in the hip, but also the knee joint as well, being pushed together. So what are the reasons for joint compression, for spinal compression? The biggest one is sitting, or one of the biggest one is sitting, whether you're driving, you're at home, or you're at work. That causes a tremendous amount of compression on the spine. In fact, when you go from standing to sitting, the workload experienced by the spine increases something like 30–40%. So sitting for short periods of time, and given if we're balanced and active, not a big deal, but for most of us, that's not the case. We're sitting at home, we're sitting at work, we're sitting in the car, and we're not getting enough movement to balance out and lengthen the tight muscles and strengthen the muscles to give us better posture. But that's another factor as well with chronic pain, and especially joint pain, is a lot of it can come from very tight muscles, muscles that are short. Muscles span at least one joint, sometimes more, but when they're tight, since it goes from one bone to another, when those muscles shorten and tighten, they press together. And just like we were showing earlier, not fun. That joint is going to rub, it's going to become painful, it's going to become inflamed. So again, sitting, but there are other activities or lack of activity, shorten muscles, pushing bones closer together than they should, or vertebra in the spine pushing on the disc in between. But also poor posture, poor movement patterns like your gait, and just general movement patterns. So this, lots of things coming together, but probably sitting is the big one, poor posture, and a lack of general movement to balance out all the sitting. Now, compression and some, if not a lot of the symptoms can be relieved by creating space, by decompression. And one of the ways that's sometimes done is traction, where an outside force is pulling the bones apart, requiring that the muscles stretch out a little bit. So, like if I had something holding the base of my head and then pulling up, like a counterweight, it would be pulling and lengthening my neck and stretching it out, which more than likely would produce some relaxation, a decrease of pain if I had issues in my neck. And that can be done on the spine, it can be done on joints, and typically it's with an external weight that helps to pull things apart. Now, while that might relieve symptoms, what is quite common is when that outside counterweight is removed, or whatever it is outside of the body and you're doing it is removed, then guess what? The compression starts to come back in, either quite quickly or even just slowly, and you end up sometimes right back to where you started. So the idea of traction is a good idea, but when you look at functional movement or somatic therapies coupled with functional exercise, you get something that is quite commonly much more effective and safer. And basically, in a nutshell, what that neuromuscular decompression is by re-educating or educating the brain back to its original, long, strong, decompressed state. So you're looking at doing movements to help the brain recognize just how tight and compressed it is. And once the brain understands, once you feel what you're feeling a little bit more, it will stimulate the self-correcting mechanism within the body from the brain through the nervous system into the muscles. And it helps to relieve some of the tension and the tightness, allowing you to relax and breathe a little bit more. But then you couple that with active movement, functional exercise, which what it's going to do is target some of the weaker muscles, because compression either is caused by or causes in and of itself a shortening of muscles, what we call lack of flexibility or tightening, which then make their opposing muscles weak because they can't be used as much. So we talk about the body, the brain becoming more aware of the positions it's in, which naturally will start to have you sit a little bit better, breathe a little more deeply. But then you go through movements that help to innervate, how to kind of reconnect the brain, strengthen the connection, it's already there, to the muscle, start stimulating it and making it stronger for all those weak muscles. And then also gently and actively lengthening muscles. And that was another video that I did about the distinction between lengthening and stretching. Same idea here between neuromuscular decompression and tractioning. And in the sense that what you're doing is using the intelligence of the brain and its self-correcting mechanism, and then some smart functional being here, exercises that the body was designed to do, what we would naturally be doing as we move around in our environment, not necessarily with equipment or machines or weights. So in combining all those, the tight muscles get a chance to relax and lengthen. The weak muscles start to strengthen. And as that comes into play, it's going to naturally cause space. Our joints want to have space in between them, but they're usually jammed and compressed, again, because of weak muscles, tight muscles, poor posture. When you address that, you start to create more space. And as that happens, most people start to experience less and less pain. Pain that's acute or chronic becomes not so intense. And if indeed nothing's been challenged structurally, i.e. a torn meniscus or a herniated disc, if structurally you're okay, even though you're in pain, and it could be chronic pain of 10, 20 years even, when you address that balancing, you're addressing the causal factor of the symptoms of pain from compression. So that could actually address your issues where you now have more space in between the vertebrae. And that will allow not only a diminishment or removal of pain, but that's also going to improve your range of motion and your basic functioning, which then also helps in other areas of the body that have been compensated or affected in a cascade manner of that area. So whether it's the spine, the low back is a big one, creating space, or it could be the hip that's been jammed up there. Very common, a lot of hip replacements now. So creating a little more space for comfortable movement, or like the knee, creating space. So what you're doing is using the intelligence of the brain and an awareness of your biology, your physiology, understanding movement from the aspect of what they call evolutionary biology or physiology, which is another subject, but it's basically understanding how the body actually moves and tapping into the intelligence of the brain, spinal cord, nervous system, and muscles to rebalance from the inside out. And I know that sometimes sounds a little bit like a cliche, but there are a lot of cliches that are cliches because they're true. That when you work by increasing your awareness of your body, going in and rebalancing your musculoskeletal system, chronic pain can start to go down. And if that indeed is the cause of your symptoms, you may actually then have no symptoms and greater mobility, greater comfort, a greater ease to be relaxed, easier breathing. You're like they talk about a vicious cycle. Something as simple as this helps to unwind it so you feel better. So again, you are thinking about using the intelligence of the body to decompress versus taking an external source to traction, which typically is temporary. And also, you have to be very careful in doing that, especially if you're dealing with the spine and especially the neck, because you want to make sure that there's not too much of a load, or that the load doesn't all of a sudden come off and then everything kind of pushes back together. So one of the wonderful things about functional movement, i.e. somatic therapies, and functional exercise is you're using your body weight, your environment, and gravity, which decreases substantially the risks you're taking and organically really help to address lots of subtle things that you're not even aware of, and lots of things that the brain does automatically. So you're tapping again into that self-correcting mechanism of the body, creating strength and flexibility and range of motion to decompress those joints, to open up the low back, create more space in the hip, the knee, almost any of the joints, increasing your movement and feeling a whole lot better. So I hope that helps.